Depression is classified as mood disorder. It may be described as feeling of sadness, loss, or anger that interfere with one's daily activities. Everyone will experience a different kind of depression. It may interfere with your daily work, resulting in lost time and lower productivity. It also can influence relationship and some chronic health conditions, such as cancer, obesity, or diabetes. It's important to realize that feeling down at times is a normal part of life. Sad and upsetting emotion happen to everyone. But if you are feeling miserable or hopeless on a regular basis, you could be dealing with depression. Depression is considered a serious medical condition, and it can get worse without proper treatment. Those who seek treatment often see improvement in symptoms in just a few weeks. Untreated depression can make it worse and cause death. The death statistic from depression is 90% of which is due to mental illness, while 60% of it is due to severe depression. Examples we can see are famous artists like Lucy Garden, Chester Bennington, and Marilyn Monroe, who also suffer from depression, and they are able to kill themselves. The disease does not know anyone and age, but the highest risk of depression is between 16 years old and above.
Depression causes 1. Family history. You are the next risk for developing depression if you have got a case history of depression or another mood disorder. Some even impact the approach that body reacts to constant and trying things. There's a bigger risk for depression in the lobe of your brain is less active. However, scientists don't know if this happens before or once the onset of depressive symptoms. Medical condition. Certain conditions could place you at a higher risk, such as chronic malady, insomnia, chronic pain, or attention deficit hyperactivity disorder (ADHD). 2. Some sicknesses have a particular medical cost, creating treatment simple. If you have got headache, you have got surgery. Depression, however, is additionally sophisticated. Depression isn't simply the result of a chemical imbalance within the brain, and it's not merely cured with medication.
Treatment for depression. Living with depression can be difficult, but treatment can help improve your quality of life. Talk to your doctor about possible options. You may successfully manage symptoms with one form of treatment, or you may find that a combination of treatment works best. It's common to combine medical treatment and lifestyle therapies.
In Malaysia, there is still lack of effort or steps that were taken to help people, especially teenagers who are suffering with depression. As we know, there is lots of talk in Malaysia about how to handle depression, tests of psychology among students, social activity on mental treatment in Malaysia, and not to forget, online counseling or hotline number for people who have depression. But unfortunately, the number of teenagers who are having depression or anxiety keep rising. Here, we want to suggest one of the efforts that we can try to make it better. In Malaysia, we can try to make a center or home for people who are suffering from depression. In the center, there's lots of activity, treatment, or even counseling session every day to make them express what they feel and make them socializing. Other than that, in that center or home, there will always have lots of fun activity at night to prevent them having a mental breakdown at night. Why at night? It's because most of people having depression, they will having a panic attack or thinking too much at night that will gonna lead them to worse condition in depression. So we hope that by this existence of Center for Depression people will help them, especially the teenagers.